Welcome to this explainer. Okay, I want you to picture a scenario. It's incredibly common, but honestly, nobody really talks about it out loud. Imagine a guy in his 30s or 40s, and he just starts noticing that something feels kinda off, you know? He's got way less energy than he used to. Hitting the gym and trying to build muscle suddenly feels like this massive uphill battle. He's noticing more fat just stubbornly clinging to his stomach. His overall motivation is tanking, and, well, his sex drive just isn't what it used to be. And, most guys in this exact situation, they just look in the mirror and think, well, guess I'm just getting older, right?
But is age actually the only culprit here? Okay, let's dive into this and challenge that assumption right now. What if excess body fat is actually the thing dragging down one of the most critical hormones in the male body, testosterone? And what if that low testosterone is essentially turning around and making it even easier to pack on more fat? It's a wild, totally hidden mechanism, and that is exactly what we're going to decode today.
Because here's the thing, low testosterone doesn't always look dramatic. A lot of times, these symptoms creep up on you really gradually. A guy might just feel like he's not operating at 100% anymore. He might be totally exhausted even after a full night's sleep, or notice a real drop in his sex drive, or find that his usual workouts are suddenly doing absolutely nothing to keep his muscle mass up. He might even be getting irritable or just losing his focus. But, and this is a really vital point, none of these symptoms automatically mean he has low testosterone. Lots of different medical conditions can trigger these exact same issues, which is exactly why getting a proper clinical evaluation is so critical.
So, here's our roadmap for this explainer. We're going to cover 1. The hidden hormonal connection. 2. Fat and active organ. 3. Brain signals and insulin. 4. The vicious cycle. And finally, 5. Breaking the cycle.
All right, section 1. The hidden hormonal connection. Let's look at the link between body weight and hormones.
Let's just answer the massive question right out of the gate here. Yes, obesity is strongly, heavily associated with lower testosterone levels in men. But the relationship is way more complicated than just saying, hey, you're overweight, so you have low testosterone. We actually have to completely stop thinking of body fat as just this passive, stored energy. It's not just a biological savings account for winter, Instead, you really need to think of it as a highly active, rogue chemical factory. As body fat goes up, especially right around the belly, it starts profoundly messing with the entire hormonal environment of the body.
Which brings us to section 2, fat, an active organ. Time to reframe how we think about adipose tissue.
So, fat tissue actually behaves almost like its own endocrine organ. It actively produces and sends out hormones and chemical signals all over the body. And one incredibly important player in this whole setup is an enzyme called aromatase. Now, aromatase can literally convert testosterone into estrogen. Let that sink in. Now, guys naturally need some estrogen, right? So the conversion process itself isn't the enemy. The problem is that fat tissue, or adipose tissue, contains all this aromatase activity. So as a guy packs on more body fat, his hormonal balance starts shifting. His body literally begins converting his hard-earned testosterone into estrogen.
Moving on to section 3, brain signals and insulin. Let's talk about the broader metabolic disruption. Okay, believe it or not, testosterone production doesn't actually start in the testicles. The body's real command center for testosterone is the HPG axis. That's the hypothalamus and pituitary gland up in the brain communicating with the testicles, basically telling them when to ramp up production. Now, what's really interesting about this entire mechanism is how obesity enters the chat. Obesity is often tied to metabolic dysfunction and this chronic low-grade inflammation. And those changes, they actively scramble this delicate hormonal signaling system. The brain's instructions essentially get lost or just completely muffled by all the inflammation. So the issue isn't even necessarily the testicles underperforming, it's that the entire communication pathway from the brain is just getting cut off.
And then, then comes insulin resistance. Obesity, especially carrying excess belly fat, makes the body way less sensitive to insulin, which forces the pancreas to just pump out more and more of it. Over time, this whole metabolic mess interacts directly with how testosterone is regulated, because obesity is associated with lower levels of something called sex hormone binding globulin, or SHBG for short. SHBG is basically the taxicab that carries testosterone through your bloodstream, so when SHBG drops, your total testosterone measurements drop right along with it. This is exactly why a doctor can't just look at one single lab number. They need all the puzzle pieces, the symptoms, the total testosterone, the free testosterone, the SHBG, to actually see the whole picture.
All right, section 4, the vicious cycle. This is where we see how the symptoms actually fuel the cause.
Let's move to this next part and see how this builds into an incredibly dangerous feedback loop.
Step 1, a man gains excess body fat. Step 2, that triggers all those hormonal changes we just talked about, like the increased aromatase activity and those scrambled brain signals. Step 3, boom, lower testosterone. But Step 4 is the real kicker here. See, testosterone plays a huge role in keeping muscle mass, maintaining strength, and keeping fat distribution normal. So when testosterone tanks, the guy loses muscle and starts gaining even more fat, which feeds right back into Step 1. It's a completely vicious cycle. The obesity causes the testosterone deficiency, and then that symptom turns around and actively worsens the obesity.
So, Section 5, breaking the cycle. Let's look at reversing that metabolic damage. So how in the world do we get out of this trap? Well, first off, we have to start looking at the right metrics. You could have two guys step on a scale, weigh the exact same amount, and have wildly different metabolic health. Why? Because where that fat is stored matters immensely. Visceral fat, that's the hard fat stored deep inside the abdomen, wrapping around your internal organs, that is the real driver here. Higher visceral fat is heavily associated with insulin resistance, type 2 diabetes, chronic inflammation, the whole metabolic syndrome package. And all of those are linked to lower testosterone. So when a doctor looks at your waist circumference and your overall body composition, that tells a much, much more important story than just whatever number pops up on the scale.
Which brings us to the most crucial and honestly the most encouraging question of this entire explainer. If you lose the weight, can your testosterone actually increase again?
The answer is yes. Research clearly shows that weight loss in men with obesity can be strongly associated with increased testosterone. So the crucial point is that greater weight loss tends to equal greater hormonal improvement. Whether a guy gets there through lifestyle changes, medical weight loss treatments, or even bariatric surgery, losing that excess fat improves multiple systems all at once. Insulin sensitivity gets better, inflammation cools down, SHBG goes back up, and that critical signaling pathway from the brain to the testicles, it finally clears up. By simply carrying less of that active adipose tissue, you drastically reduce that hostile hormonal environment. For a lot of guys, the low testosterone associated with obesity is, at least partially, reversible.
Now we really need to talk about sexual health for a second, specifically erectile dysfunction, because obviously it's a huge concern for guys dealing with this. As this quote perfectly highlights, an erection depends heavily on healthy blood flow. While testosterone is absolutely a piece of the puzzle for sexual function, we literally cannot ignore the vascular system.
Because obesity brings along several major risk factors for ED: diabetes, high blood pressure, messed up cholesterol, and overall cardiovascular disease. All of these things damage your vascular function. If a guy with obesity develops ED, just asking, hey, how do we get better erections, completely misses the forest for the trees. The real question has to be, what is going on with this person's overall metabolic and heart health? ED shouldn't just be treated as some localized testosterone issue, right? It is so often an early warning siren for broader cardiovascular danger that really demands a proper medical evaluation.
And there's another totally hidden factor that supercharges this whole negative cycle: sleep. Obesity significantly bumps up the risk of obstructive sleep apnea. That's a disorder where you literally stop breathing over and over during the night. A guy might be in bed for 8 hours, but he wakes up feeling like he just got hit by a truck because his sleep quality was completely fractured. And poor sleep profoundly wrecks your hormonal health. Think about how this combos together. Obesity causes poor sleep, which tanks your energy, which means you're way less likely to exercise, which causes more weight gain, and ultimately even lower testosterone. It is so often the missing piece of the puzzle.
All of this perfectly illustrates why having obesity absolutely does not mean a guy just automatically needs to be slapped on a testosterone patch or injection. Hormones don't just operate in a vacuum. Testosterone is intimately tied to your metabolism, your insulin, your sleep, your entire lifestyle. A real clinical diagnosis means a doctor evaluating symptoms right alongside repeated lab tests, and most importantly, hunting down the root causes. Are we dealing with sleep apnea? Is it metabolic syndrome? Are there other medications getting in the way? The treatment has to target the actual root cause, not just artificially pump up one single lab number.
Which leaves us with this final thought. If you or maybe someone you know is experiencing these symptoms, you really have to stop and ask, are you just trying to fix a single hormone number on a piece of paper? Or are you actually ready to optimize your overall metabolic health? Because as we've seen today, addressing the real root cause, that excess biologically active fat, it doesn't just improve your testosterone. It improves your heart, your energy, and honestly, your entire life. Thank you so much for joining me for this explainer, and I really hope it helped you see your